Because this diagnosis was my second round with cancer, it was pretty frightening because I knew what had happened before and what I'd gone through, and it didn't help too that when I was diagnosed, it was diagnosed at a stage 4, so it was already fairly advanced. So in that respect, it was, it's very frightening. It's a frightening thing to hear. You still have to live. You have to live your life.
What CARE does is that it brings certain research opportunities for our patients, which means new innovative treatments to the Tacoma area, to our South Sound area, that otherwise would not be available. Some of these treatments are, frankly, profoundly effective and very innovative. And CARE's played a big role in bringing those here to our community. CARE's focused on bringing that research to anybody who needs it, irrespective of income, etc., so that they can take advantage of that great research.
When I was first diagnosed, we went through what would be considered the standard treatment for my cancer. And unfortunately, after the 6 months of treatment, the cancer returned. So now we're at a point where it's not quite as clear what the plan is. And so Dr. Senecal was looking into, other alternatives as far as studies that I could participate in that might help. And then the one study that I'm in, the atomic study, is through CARE.
When I first started in this community in 2001, I started seeing patients with breast cancer immediately, and the way that we treated cancer at that time has evolved so tremendously in the past several years. Just like every human being that's different from each other because of their genome, cancers have their own genome. Because of that, they have all different behaviors. Therefore, putting patients into one type of treatment because of just the size of the tumor turns out to be not the correct way of treating cancer today.
Having cancer is sometimes very difficult to deal with anyway, so having the ability to stay within your own community is a really positive thing. To have your own physician and to have the support of the people from CARE that will give you the information that you need and kind of help you on your way. I couldn't be here if I was constantly having to, travel somewhere to receive treatment. So I really appreciate the ability to stay in my own home and be comfortable and be with the people that I love.
I really truly believe in this. I believe that we are into something. And we are into something that the others are trying to figure out in other parts of the country and the world, but we're already doing it. We're way ahead of the time, and the people in this community helped it to make happen.
It would be well worth any information that we can get from these studies to help hopefully me, but hopefully many other women who have this cancer.